everyone. My name is Jane St. John, and I'm here to do my simulation assessment. This is my daughter Cecilia. She's going to be my patient. We're beginning with the lymph nodes, which is cranial nerve number 5, and I'm going to begin. So I'm going to be standing behind her to palpate her nodes. We're going to begin with the pre-ocular nodes, the post-ocular nodes, the occipital, which is the behind her neck, and then the tonsillar, which is the beginning of her jaw, the submandibular, which is the edge of her jaw, and the submantle, that is her chin. Then we're going to proceed in the anterior cervical, which is the front of her neck, the posterior, which is in the back of her neck, and then the supraclavicular, which is above her clavicles. Next, we're going to do sensory. So I'm coming around and I'm going to palpate her forehead. You feel that?
Yes.
And her cheeks. You
Yes.
feel that? And how about your chin?
Yes.
Okay. So next we're going to have her. That is cranial nerve 5. Now we're going to do cranial nerve 7. I'm going to ask her to smile. I'm going to ask you to frown. I'm going to ask you to lift your eyebrows. And then I need you to puff out your cheeks and then purse your lips. Perfect. So her cranial nerve number 7 is intact. Next, we're going to look at the ears. I'm going to go get my otoscope. So we're going to be looking at the auditory canal and the tympanic membrane. Okay, so let me sure this is on. I've got a light. So now I'm going to be looking into her ear, looking at her auditory canal. So I don't see any redness or swelling. There's no drainage, and there is some serum, but I would say it's very minimal. So now I'm going to go on the opposite side and I'm going to look at her tympanic membrane. Okay, so I'm pulling the auricle up and back. I did that on the other side. I'm looking at a tympanic membrane and I'm looking at it. It's nice and opaque pearly. And it is intact and there's no infusion. Okay, so the next thing that we're going to do is the whisper test. I'm going to turn this off. So the whisper test, what I'm going to do is I'm going to place my hand over one ear, whisper in the other, and then vice versa. So I'm going to start on her right. I'm putting my hand over her right, and I'm going to say words, and she's going to repeat it.
Shrimp. Knock. Penny. Zero. O. 4.
Okay, great. So her hearing is within normal limits bilaterally. So the next thing that we're going to be doing is looking at the eye. This is cranial nerve number 2. I'm going to switch off. I get my ophthalmoscope. Sorry, give me a minute. Oh my gosh, I'm sorry. It's giving me a hard time. This new equipment. Oh, here we go, I think. My apologies. Okay, here we got it. So the first assessment I'm going to do is on her pupils. I'm going to look at her pupils. Well, no, I'm sorry, excuse me. I'm going to assess her peripheral vision. So I am going to be behind her and I'm going to wiggle my fingers and then she's going to let me know when she sees my fingers, okay?
Okay. Now.
Okay, great. So her peripheral vision is intact and healthy. The next thing I'm going to do is to look in her pupils to see if they're reactive. Okay, so her pupils are reactive to light and they are 3 millimeters. Next thing we're going to do is, oh my gosh, excuse me. I am going to look at the blood vessels in her eyes, make sure that there's no hemorrhage. So I'm going to take this off and I'm going to get very close by putting my hands on, and I'm going to be looking. No hemorrhages are seen. And no AV nicks. Okay, so the next thing I'm going to do is stand in front of her. And I'm going to do the H, so she's going to follow it with her eyes. Her peripheral vision is fine. Okay. I put my glasses back on. Thank you. Can't see anything. Okay, so the cranial nerve 3, 4, and 6 are intact. It is the trochlear, the coacular, I didn't say that correctly, and the abdomen. I'm sorry if I mispronounce. Okay, so the next thing that we're going to do is, I'm sorry, we're going to assess her throat and her mouth. So I'm going to switch. So I'm going to look in her mouth. We're going to assess. Where'd that go? Her teeth, her tongue, her gums. Okay, can you open your mouth? Thank you. Open your mouth. Looking at the teeth. The teeth, there's no decay. I'm looking at her gums. The gums are nice and pink. I'm looking at her tongue. Stick your tongue out. Tongue is nice and moist and pink. Can you lift your tongue? Underneath, the floor of the tongue is nice and pink. Now I'm looking, open up, I'm looking to stick your tongue out. The uvula is symmetric and there's phonation. The buccal, both sides of the cheek are pink, nice and pink and moist. The soft and hard palate are intact, nice and pink. So open your mouth and say ah. Okay, so the back of her throat, the postpharynx is pink. Okay, so the next thing we're going to do is I'm going blank. Is to check your tongue and stick it out and then go from side to side. Okay, so the next thing I'm going to do is your nose. We're going to look at the turbulence and the septum of your nose. So I'm looking into her nose, and I'm looking at the tip of her nose. Her nose is nice and straight. The septum is nice and straight. I'm looking into the nostrils. They are nice and pink. Looking at the septum. The septum is midline and straight, and there's no deviations. Okay, so the next thing I'm going to do is believe that we are done. We're completed for the evening. Thank you.